I want to start out with, I have this slide here showing recently what was told me by the first Yanomami that I met in 1995. Here you see in the middle of this photograph holding two arrows who had also gotten COVID and luckily has survived it. But I met him 25 years ago, and his son, Alberto, from the community of Maturacá. He's also the former president of the Yanomami Health District Council, known as Condice, in Brazil. So this is what he shared with me about his experience with his father. I just wanted to sort of try to contextualize this a little bit, how we're talking in the world now about the question of this pandemic. Everybody is struggling with the pandemic. Although we know the origins of the new virus, we do not have reliable treatments, vaccines, or immunity. We do know, however, the social impact of COVID-19 and that it affects all segments of society, but particularly vulnerable individuals and communities. PAHO, the Pan American Health Organization, states that indigenous people have been 10 times as likely to contract the virus. So thus far, what we have are an attempt to a unified social response that reflects our worldview, those that are subscribing to social distancing, masks, hygiene, and contact tracing, that considers this worldview of adopting this reflects considering the well-being of others, ourselves, and also one of humanity sees humanity as part of the natural world rather than as a master of it. What lacks, we have seen, is a universal strategy, a global consensus to this, adopting social behavior that is believed to reduce collective anxieties and contain the spread of the virus and save lives. So I just wanted to share a little bit from a friend of mine, Mark Plotkin, article, a recent article that he has on coronavirus and conservation preventing the next pandemic. This is a response to the situation of zoonotic diseases. And I just wanted to share a little bit of what Mark talks about in this to try to tie it in to situate, trying to capture the Yanomami response and their interpretation of what's happening, what they call shawara, or epidemics. They know this through the malaria, measles epidemics, but with COVID, now we are all in the same situation. We're all suffering from it, but of course in different ways, as we see from the slide here from PAHO. So in terms of the zoonotic diseases, we know that they are one of our biggest threats, which includes Ebola, MERS, H1N1, malaria, and coronaviruses. Studies have shown that evolutionary processes are directly related to various ecological imbalances, such as overhunting, deforestation, climate change, and overall disrespect for the environment and ourselves. Medical sciences have made tremendous advances since the 1918 influenza Spanish flu pandemic, but today such efforts have been counterbalanced by the challenges that we have and with population density, globalization, environmental destruction, the violation of basic human rights against the people who are most vulnerable to infectious disease, and of course dismissing conservation in general. Sorry, go back to the next one. So climate change promises to bring more pathogens such as malaria and zoonotic diseases, including coronaviruses. Since COVID-19 appears, the focus has been on wet markets, but we may be losing focus of some of the areas and sources of where these zoonotic diseases and viruses are propagated from. This is something that resonates with what the emerging leader, Sonia Wadajara, has talked about, Amazon leader, has talked about, and as COVID began, that we were losing somewhat of focus of some of the major issues that had started last year with the question of indigenous lands. So we have several factors that are happening in the Amazon, and this is what I want to get to. So we should not lose sight of the tropical areas of the world and the environmental conditions where many of these zoonotic viruses have originated. There are also many human-induced factors that potentialize environmental health problems in the tropics and the Amazon rainforest. We have a long history of pathogenic exchanges that occurred in developmental projects. We have construction of hydroelectric dams. We have road building, as I mentioned, with the Yanomami during the 70s, the Perimetal Norte, that was designed to cut across the middle of the territory. We have deforestation that is up tremendously, up 50% from last year. The first 3 months of this year, studies have shown it's increased by 50%. We have mining, cattle ranching, and of course, logging. So, Brazil, nearly half the size of South America, is one of the worst affected countries by COVID in the world right now, just trailing the United States. We also see in Brazil that they have almost 900,000 indigenous people who are amongst the most vulnerable for the spread of infectious diseases. With COVID happening now, I'll show some of the data on that. This should be understood within the context of rainforest destruction in Brazil that I just mentioned about from last year, the 50% increase. So the first case of COVID in Brazil was detected in February 25th from a man in Sao Paulo, and this spread throughout the country and every state within just short of a month to March 21st. And today we have nearly 5.4 million cases. In July, almost 4 months after the onset of the pandemic, the federal government presented a plan to address COVID in indigenous populations, but this plan was criticized as being generic and has never got off the ground. In the Brazilian Amazon, the pandemic has underscored the wider concerns of indigenous healthcare. The Brazilian indigenous representatives have reported problems about accessibility, distribution of medical supplies, including PPEs, expired medicine, and denouncing unaffected medical professionals that have been designated to their areas or have not been allowed to come into their areas, given the context of COVID. These last two factors in terms of denouncing ineffective medical professions and expired medications, lack of medical supplies, this is nothing new, but it is something very much right now highlighted given the context. There's a lot at stake. So there's divergences with amongst the data that we have here showing the amount of infection rate that we have, the infection, infected, people infected amongst the coalition of the indigenous peoples of Brazil is showing 38,124. This is recent as of yesterday. And we also have the official government showing 32,232, and then deaths 866 with the APIP and CESAI, which is the official, are showing 474. The main difference is where the indigenous peoples are living. APIP is accounting for indigenous people that live in cities as well. So we have the response from FUNAI, the National Indigenous Bureau, that has delivered food baskets, hygiene and cleaning kits, and promoted community inclusive healthcare protocols for local awareness and to try to share and promote this idea of the pandemic amongst communities, which is important, but it's an important policy and action. However, they do not solve many of the structural issues that we see right now that are culminating with COVID, which would be guaranteeing constitutional land rights and long-term differentiated indigenous healthcare programs. So I will be, for this session, I'll be talking about some data that I have from a campaign. I'll be showing also one of the leaders, the young leader of the Yaquana, the Yanomami Yaquana in Brazil, saying the same territorial space, land, and I will be showing that small video towards the end. The Yanomami are one of the largest, well-known, and relatively isolated indigenous people of the Amazon rainforest that reside along the Brazil-Venezuela border. In 1992, the Yanomami and Yaquana indigenous territory was demarked and stands as one of the largest indigenous territories in Brazil. In the 40s, initial contacts happened. They were marked by measles and flu epidemics. In the 80s, we have what's the resource curse, that discovering of gold and other precious minerals in the Yanomami territory. This brought a huge wave of gold rushes and also epidemics. The Yanomami explanatory models of disease are based on shamanic beliefs, whereby victims fall ill to the pathogens sent by aggressive invisible enemies. Based on their lived experiences with epidemic, shamans have been warning of the mass destruction that all humanity would experience. So right now, there's a feeling of the realness of this, sort of a self-fulfilling prophecy that has been going on, and they've been talking about this since contact. Therefore, the current global crisis resonates with their apocalyptic vision and this zoonotic pandemic. So again, I mentioned the Yanomami's concept for epidemics is called shawada. It is particularly shawada for them is associated with malaria. With the introduction of COVID in the territory, they believe that shawada virus is originating amongst whites and thus can be cured, only be cured by them, whites outsiders. Nonetheless, their traditional healers are working nonstop trying to eliminate the symptoms. Since the 80s, shawada is associated with illegal gold miners, and it was garimpeiros because they bring malaria into their communities. So some of the communities that live close by are some of the gold mining camps that are located in the regions of some of the communities within the Yanomami area, including the first Yanomami to get to be diagnosed and to die from COVID on beginning of April, was a 15-year-old boy that lived in a community where the gold miners are. So there's this idea that it is coming from the gold miners. Their interpretation, they view shawada, this association with epidemics and gold miners, is when they think of shawada, they associate with garimpeiros of gold miners and compare the behavior to bands of filthy wild boar that rage through the forest, destroying the land and polluting the rivers. This is a photograph of when I was in the field at first in 2008, and also recently with Alberto in Brasilia discussing COVID. We have in the area, Yanomami area, 26,780 Yanomami and more than 20,000 gold miners. So right now we have Davi Kopanawa and other young leaders that are trying to motivate, to get the government, trying to convince them about the seriousness of the problem with COVID in the area. So I want to just, before I get to the video of Mauricio, I do want to show there are multiple factors that constitute the social determinants of health amongst the Yanomami and other indigenous groups during the pandemic. On one hand, we have environmental threats, encroachment from illegal gold miners who are polluting the rivers and forest and threatening their biocultural existence. On the other, inadequate healthcare system and absurd negligence for treatment of this deadly virus. So I want to share right now the miners out. This is photographs with the Yanomami here, the territory. Davi Kopanawa has been actively engaged in trying to get the gold miners out and campaigning around through the UN in Geneva. And recently in 2019, he won the Right Livelihood Award. And on his trip to Geneva to receive this, he also brought members of this indigenous organization, including Mauricio Yaquana. ISA, a group that is associated, that works with the Yanomami and the Federal University of Minas Gerais, were involved in a study that has shown that COVID amongst the Yanomami could affect up to 40% of their communities that are surrounded by gold mining. We have this is I want to share this, the sites here, if you would like to check them out. The campaign that was supported by the Brazilian NGO Connectus, they invited Mauricio to participate in the National Human Rights Council, and several organizations petitioned the government authorities to remove the illegal miners and combat COVID. I just wanted to show you his video here.
Señora Presidenta, mi nombre es Mauricio Yaquana, soy director de la Utucara Asociación Yanomami y estoy aquí en representación del Foro de Liderazgo de la Tierra Indígena Yanomami. Nuestro territorio está siendo invadido por más de 20.000 mineros irregulares en búsqueda de oro que trae enfermedad como la malaria, bebidas alcohólicas, drogas y violencia a las comunidades. También contaminan nuestros ríos con mercurio. En 2020, 2 Yanomamis fueron asesinados por mineros en búsqueda de oro. Durante la pandemia, los mineros han llevado a COVID-19 a comunidades que viven cerca de las minas. Los líderes hemos pedido al gobierno brasileño que cumpla con sus obligaciones para remover a los mineros ilegales, pero no hay una respuesta adecuada a este problema. Por el contrario, el gobierno expresa discursos que incentivan la explotación ilegal de oro en tierras indígenas de la Amazonía y que intensifican las amenazas contra nosotros. Seguimos viendo cómo se destruye el bosque. Es por eso que vengo una vez más a denunciar la negligencia del gobierno Brasil con los pueblos indígenas y con nuestra madre tierra. Y pedimos ayuda a la comunidad internacional para que se respeten nuestros derechos. Gracias por escuchar mis palabras.
This is the statement left by Mauricio that he gave to the UN. And I just wanted to share this and invite everyone to participate and to sign the petition. This was in the video you saw Mauricio accusing the federal government of negligence in fighting COVID and asked for international support to help Brazilian indigenous peoples